Now I will check the 360. Now I will perform hand hygiene. So, hi, good morning. How are you today?
Good, thank you.
Okay, so I'm Teresita Ayunon. I'm your nurse for today. I'm here to assess your head to toe as ordered by the doctor to as baseline data for your overall condition. So, I will take your 15 minutes time if it's that okay with you.
Yes.
Okay, so can you please tell me your name and your date of birth?
Harding Tarama, September 6, 19.
Okay, so while checking the armband, okay, so you're the right patient. So I'll just close the curtain for some privacy. Okay, so assuming that I'll check already the patient vital signs and the findings within normal range. So, Harleen, do you have pain right now?
No.
Okay, so if yes, I will ask the patient to rate the pain scale from 0 to 10. 0 means ano pain, 10 means severe pain. And then I will use the OPQRSTU to note the onset, location, quality, quantity, severity, relieving, radiating, triggering factors of pain, and understanding of pain. Okay, so I'm asking questions, and usually these are I'm asking for every patient. Okay, so do you know where you are right now?
Yes, I'm here in Bathurst.
And what is the date of today?
Today is July 1, 2023.
Okay, so I will proceed the assessment of neurological assessment. So I will start on the Perla eye test. So this means the pupil are equal round reactive to light and accommodation as well to check also the confrontation. So this procedure, I will stroke the light into your both eyes. Then just to check the constriction of your pupils. So this procedure I will take 2 times. Okay, so now I will check the accommodation by looking into this my finger for you to look and focus on. Are you having double vision?
Yes.
Okay, so now I'm going to check the confrontation by closing your both eyes, but we will start on the left eye. Then after assessing this, to follow the right eye with the same procedure. Okay, so please close your left eye. Okay, so please look at my fingers and then I will show the number and then tell me.
2, 2, 2, 2.
Okay, so please the right eye.
2, 2, 2, 2.
Okay, so now I'm going to assess your cranial nerves 3, 4, 6, and 7, which are the oculomotor, trochlea, abducens, and facial nerves. So I will use the 6 cardinal positions of gaze. So don't move your head. Just look on my finger by your eyes only. Please give me your sweet smile. Okay, so raise your eyebrows. Then close your eyes tightly. Then pop your cheeks. Okay, so for the findings, Harleen is conscious, alert, and times 3 oriented. The cranial nerves 3, 4, 6, 7, oculomotor, trochlear, abducens, and facial are intact. So there is no signs of nystagmus, palsies on ocular muscles, no ptosis or dropping. Facial is symmetrical. So the pupil are bilaterally equal, round, reactive to light, and accommodation, meaning if looking for the far distant objects, it is the pupil will dilate, and while looking on the near distant objects or light, the pupils will constrict. So okay, so we'll proceed to the respiratory assessment. So Harleen, do you have a shortness of breath rest? How about ongoing exercise or exertion and lying down?
No.
Okay, so assuming that I exposed already the chest of the patient, so I will note the presence of masses, lumps, cyanosis, or erythema. So I will observe also of if she's using her accessory muscles, retractions, and breathing. Okay, so Harleen, can you lean forward to check the posterior part of your lungs? So while auscultating, so you will do deep breath, inhale and exhale, okay? Okay, so the findings of this assessment, Harleen has equally bilaterally chest rise, and then she didn't use any accessory muscles retractions on breathing. There's no non-labored breathing also. So I didn't heard any adventitious sounds like wheezes, crackles, friction rub, or stridor. So and then she didn't exhibit also any signs of respiratory distress. There is no mass lesions or cyanosis and erythema upon inspection. So, Harleen, please, I will check also your cardiac assessment. Okay, so by using the bell of the stethoscope. And then this assessment will locate the 5 locations to listen the heart sounds. So I will start in the right second intercostal space, which is the aortic valve. Then across to the second, to the left second intercostal space, which is the pulmonic valve. Then going down to the left third intercostal space, which is the Erb's point. Then going down to the left fourth intercostal space, which is the tricuspid valve. Then on the fifth intercostal space, mid-clavicular line, which is the mitral valve. This is the maximal point of impulse to locate the apical pulse. So from this point, I will count the rate from in 30 seconds if regular. Then if irregular, I will count in 1 full minute. So start. Okay, so for your heart rate, it is 80 beats per minute. This is regular rhythm. There's no murmurs noted, and the heart sound is normal with S1 and S2. Okay, so we'll proceed to the abdominal assessment. So, Harleen, when is the last time you urinate or defecate?
2 hours.
Okay, so can you please lie down? So assuming that I exposed already the abdomen of the patient, so I will note the abdomen contour, size and shape. I will inspect also if there is presence of mumps, lumps, redness or swelling on the umbilicus area. So now I will auscultate the bowel sounds of the abdomen on the 4 quadrants. So by starting in the right lower quadrant, then going up to the right upper quadrant, then transverse to the left upper quadrant, then going down to the left lower quadrant. So I will listen also, I will auscultate also by using the bell of the slit, the arteries of the abdomen. So I will start in the aortic, then I will check the renal arteries on right and left arteries, then going down to the left iliac to the right iliac, then going down to the right femoral to left femoral. Okay, so now I'm going to palpate your abdomen. So please tell me if you have pain during palpation. So by starting in the right lower quadrant, you have pain?
No.
And going up to the to the right upper quadrant, then transverse to the left upper quadrant, then going down to the left lower quadrant. Okay, so now the assessment findings, Harleen has no colon signs. The abdomen is round, flat, and symmetrical. Then I heard 20 gargling sounds, high pitch, cascading on 4 quadrants. So there is no bruise or washing sound noted, and there is no rebound tenderness and no rigidity. Okay, so now I'm going to assess the upper and lower extremities. So these are the included the integumentary. Okay, so now I will check the hands if there is deformity or wounds, lesions, scars, presence. So no. So I will ask you also if you have pain at this time on your extremities or numbness or tingling sensation. No? So, okay, I will check also the edema. So, there's no edema. Then, I will check the skin temperature. Okay, so with warm skin to touch, I will check also the skin turgor. Okay, you have good skin turgor. So, now I will check also your capillary refill. So, less than 2 seconds, the nail beds are pinkish and there's no clubbing noted. So, can you squeeze my hand? Okay, please can you upward your hands and I will put pressure then give pressure against me. Okay? So, we'll do it the same procedure downward. Okay, so now I will check your radial pulse. Okay, so now we're going down to the lower extremities. So, by checking the pedal pulses and the posterior tibial pulse. So, I will check also the size of the legs. It is equal and there's no deformities, lesions, and wounds noted. Then, I will check also the temperature. You have warm skin to touch. And the edema. No edema noted. So, I will check the skin turgor. You have good skin turgor. So, I will check the capillary refill time of your nails, nail beds. Less than 2 seconds, pinkish and no clubbing noted. So, can you please upward your, point up your toes towards your head. Then, I will put pressure and you give pressure against me. Okay? And then, put down also, downward also your toes. So, I will give pressure and you give pressure against me. Okay, so for the findings of the extremities and integumentary, so with the pulses are regular, equally bilateral strength +2. So with warm skin to touch, with a good range of motion, no edema, with good skin turgor, no signs of dehydration, and then there's no pain, no numbness and tingling sensation, and then with strength +5 grip. And there is no also, and the capillary refill is less than 2 seconds. Okay, so thank you for your cooperation. If you have concerns, just push the bell only. Then I will come as soon as possible. So for the documentation of your findings, I will document on your chart. And I will raise your side rails and I will put the bed on lowest position. Thank you. Now I will do the 360.